Welcome to the BMJ's Medicine and Science podcast. I'm Cameron Abbasi, Editor-in-Chief of the BMJ. Now, you'll have noticed we've had a slight name change, but we're still bringing you in-depth interviews and insight from the world of medicine and science. This week, an investigation by the BMJ uncovers competing interests in the group advising the government on nutrition. We'll hear from campaigners on why that matters.
We know that financial conflicts of interest affect behaviour. We know it with doctors, we know it with lawyers, we know it with politicians. That's why we regulate financial conflicts of interest.
We'll also hear from a former advisor on why conflicts of interests are baked in.
The way research is often constructed in the UK is that research funders require some partnership with the food industries.
First this week, the Bill and Melinda Gates Foundation has just released their Goalkeepers report, the headline of which is the detrimental impact that poor nutrition is having on children's health. Duncan Jarvis talks to their Director of Maternal, Newborn, Child Nutrition and Health, Rasa Izadnegahdar.
If I had a magic wand where I could get rid of one awful thing in the world, I'd use it to get rid of malnutrition. It's the greatest health inequity in the world, affecting 2 in every 3 children. And climate change is making this crisis even harder to solve. But the good news is we can make huge progress reducing malnutrition. We already have a number of innovations that we know work well.
Hi Duncan, I'm Rasa Izadnegahdar. I'm a pediatrician by training and lead the maternal, newborn, child nutrition and health team here at the Gates Foundation.
Now, in his introduction to this report that we've just heard, Bill Gates says that he wants a magic wand to fix nutrition, to fix health. Why has that been singled out as the key issue facing children today?
I think there's a couple reasons for that. The first one is nutrition is truly an underlying risk factor for many of the bad things that can happen to populations. I saw this in my own experience as a doctor working in Zambia, that a lot of the children we were seeing who had pneumonia actually were not really dying of the pneumonia per se. When you excluded the children who were undernourished from the work that we were doing, the case fatality rate, how many children are dying, fell from 30% to 0.3%. So you start to see that it's really about almost the nutritional status which a person has when they become sick that gets in the way of their recovery. Now, why are we excited about what's to come? It's because you really can address nutrition whether you work on longer term projects like improved crop varieties, improved nutrition-dense crops. And then you start thinking about, well, what are some additional needs that a population might have? We know that there are huge growth spurts in infancy, in adolescence. We know there are additional needs in pregnancy. So making sure that they have access to nutritious products. And then what are those nutrients actually achieving and understanding those? So for example, our group is really working with partners and local institutions, governments, to advance this concept of a multiple micronutrient supplement. This is now at a very low cost of manufacturing and therefore able to be scaled globally to make sure all women who are pregnant have access of having a nutritional replete pregnancy rather than even their own health being compromised in the context of that pregnancy.
The sense I'm getting from you is that despite the challenges of climate change, despite the challenges of nutrition, you seem fairly hopeful.
Absolutely. I think there's many things that we can do right now, and I'm hopeful in particular for how we're better understanding the problem. We're in a world right now where we're just scratching the surface of the importance of food, and you see that everywhere. You see the power of microbiome, for example, in addressing inflammation and how that enables absorption of nutrients. This is all really cool biology that's been there. I like to talk about one specific organism, Bifidobacterium infantis, that has evolved with human beings for hundreds of thousands of years, really in order to provide the kind of enzymes that a human doesn't have, but a baby needs in order to digest and absorb nutrients from breast milk. And so when that's there, when the infant is born, then all of a sudden breast milk that they are drinking becomes that much more of a robust food, even more so than it already is with all of the nutrients that are in there. So there are these critical things that we're starting to learn, and that's what gives me hope and optimism.
Talking of microbiome, a concern in the UK has been the effect of ultra-processed foods on the microbiome, but not only on the microbiome, obviously, but on obesity and other problems like that. And I know that in, for example, India, the big increase in the similar kinds of foods has led to worries about the nutritional state of children there. Is that a concern that and something that you're looking at in the foundation as well?
Yeah, absolutely, Duncan. I think it's really interesting to think about that because even we at the Gates Foundation come at this from the lens of undernutrition. But actually, when you think about a healthy diet, you're addressing an underlying cause of both under and overnutrition. And the point you make is actually absolutely correct, is that we are seeing increasing overnutrition in many of these settings at the same time as there still remains a substantial burden of undernutrition to address. That's true in childhood, that's true in pregnancy. And so if you break down the focus to what does a healthy diet look like? Multiple food groups, nutrient-rich crops, those benefit both aspects of that. And then the connection of that to disease. Diabetes is a perfect example. We often think of diabetes in the context of overnutrition, and we recognize that some of these sort of diet approaches, microbiome approaches, actually may aid that as well. And that's critical because otherwise, if you're only thinking of undernutrition as providing more nutrients, then you're only helping one side of that problem, which is the undernutrition side, rather than digging down to something that's fundamental to both.
That's big picture stuff. We're talking about whole societies here. So I'm wondering, is that going to change your focus a bit within the organization away from the technical things that you talked about earlier to more of this big picture kind of thing?
Well, at the Gates Foundation, we often think, what is the best way for us to intervene or engage with the system in a way that's additive and complementary? Often that ends up being a focus on innovation. But even if we focus on innovation, a recognition that for any of this to work, a whole system has to come together is critical. So, for example, that's why we work so closely with governments, with on-the-ground partners, with farmers, with private sector that's engaged in bullion manufacturing or fortification broadly. So there is certainly an inroad that the foundation tends to have on how do you harness knowledge to really have targeted innovations. And that's where we want to make sure we're contributing solutions to the problem. But a greater recognition is there in terms of, well, how will any of these ever achieve impact? They have to be, particularly nutrition, integrated into that system with a larger set of partners. Nutrition, again, food you eat every day. You have to eat every day. And so it's something that is not as simple as, okay, just take this thing and then you're fine. Even when I think about in the context of pregnancy, multiple micronutrient supplements, which is far better than the existing iron folic acid. It has 15 micronutrients instead of 2. It's $2 for the whole pregnancy. It's still something you have to take on a daily basis. There's no sort of silver bullet magic. Here it is, you're all done. So that is a complexity with any nutritional intervention, and yet often our role is how do we put all of that knowledge together so that the world can know this is a best buy, or a government can know if I have nutrition resources, I should invest it this way.
Rasa, thank you so much for joining us. And the report that you've been talking about, Goalkeepers Report 2024, is available on the Foundation's website and will link from the podcast text.
A new investigation in the BMJ has found that the UK government's Science Advisory Committee on Nutrition, The people who help guide the UK's nutrition policy have competing interests in relation to the food industry. Jennifer Richardson, the BMJ senior features editor, finds out why that is undermining their credibility, but also why research funding policies are perpetuating the problem.
This week, we've published a new investigation by Sophie Borland into conflicts of interest in SACN, the UK government's Scientific Advisory Committee on Nutrition. We think competing interests in all levels of science are a problem, and when I spoke to Chris van Tulleken, assistant professor at Imperial College London and author of the book Ultra-Processed People, he explained why.
I think there are three main problems with the financial conflicts of interest between SACN and the food industry. The first is it damages the reputation and the credibility of the committee. Some of these relationships are with companies that have been well established over many decades to be causing harms, to be selling products that they know damage human health and are really driving this pandemic of diet-related disease. To partner with these companies really undermines the work of the committee. The second thing is that we know that financial conflicts of interest affect behaviour. We know it with doctors, we know it with lawyers, we know it with politicians. That's why we regulate financial conflicts of interest. And we have lots of evidence. And by looking at the very wide body of literature, we know that medical professionals, for example, are affected by relatively small gifts from the pharmaceutical industry. So conflicts matter and you can't mitigate them. Disclosing them doesn't get rid of them, okay? The final, I think, and most important thing is that these relationships launder the reputation of an industry which is producing products that are now arguably the leading cause of early death globally. They are the leading cause of plastic pollution, they are the leading cause of loss of biodiversity, they're the second leading cause of carbon emissions, and they cause a pandemic of diet-related disease, not just obesity, but a wide range of other negative health outcomes. And partnering with arguably one of the most kind of blue chip, respectable nutrition committees on the planet really benefits these companies. So there's this double jeopardy. It damages the committee, the credibility, and it really helps the companies sell their products.
Okay. The Soil Association is a UK charity that aims to change the way we eat, farm, and care for our natural world. And as part of that, it is worried about industrial food production. Rob Percival is head of food policy, and when I spoke to him, he shared Chris's concerns.
So, Rob, all of these conflicts of interest are publicly declared, so they're not a secret. What's the issue with these conflicts existing, even though they are publicly declared?
So our concern is that the committee and its integrity might be undermined by these ties to the food industry. That's not to say that individual scientists have been corrupted. This is a systemic challenge. But there's now really good evidence that the conflicts of interest at the interface of science and policy can skew either specific policies or public narratives in favor of the food industry in ways which ultimately undermine public health.
In July last year, because of growing interest in the effect of ultra-processed food on our health, SACN released a statement on processed food and health. It warned that increased consumption of ultra-processed food was associated with increased risks of adverse health outcomes, and added that there were uncertainties around the quality of evidence available.
Did SACN's July 2023 statement on UPF go far enough?
No, it didn't go far enough. We're really pleased that SACN is looking at this issue, but we think they should have been more clear in their conclusions, particularly around the importance of whole and minimally processed foods. We know that adherence to the Eat Well Guide, UK dietary guidelines, would entail, for many people, increased consumption of those foods. And SACN nowhere acknowledged that there was this misbalance in the national diet, this case for increasing consumption of Nova Category 1 foods. So in addition to looking at the harms of ultra-processed foods, I think they should be looking more broadly at the case for rebalancing the national diet.
And how might the issue of conflicts of interest between SACN members and the food industry be solved or alleviated? What would you like to see happen?
Well, this is a really complex issue, and it's a systemic issue. We need to think about whether government is investing adequately in research, the choices and agency that scientists have, where the incentives are in the system. At the recent Lords inquiry, Professor Susan Jebb of Oxford University said that these challenges were so deep-rooted and complicated that they warranted a public inquiry in themselves. And we'd support that. We'd support government launching a public inquiry into the influence of the food industry over science and policy. And I think what we're seeing internationally is growing recognition that you need to go beyond declarations. It's not enough to just declare conflicted interests. At UNICEF, World Health Organization, UN Human Rights Council, there's now clear and specific guidance that governments need to take a more robust stand. So I think in the UK, we need to be emulating that international example and going beyond declarations, including on SACN.
Some people, including Chris van Tulleken, would like to see a programme of deconflicting SACN over time, leading to no members being admitted to the committee if they have conflicts of interest with the food industry. However, others say that refusing to allow experts with industry ties onto SACN would diminish its expertise. One of those is Alison Tedstone, the former Chief Nutritionist of Public Health England.
So I think that would be quite a tricky, high-risk strategy to have no members of a nutrition advisory committee that had any links to the food industry. The way research is often constructed in the UK is that research funders require some partnership with the food industry, such as you get higher scores in the process if you have that relationship. Some committees around the world have taken the decision not to have anybody with any possible ties with the food industry. And my experience is that weakens the committee because people tend not to be research active. So I think to inform science, you need the people that are kind of at the top of the game who are research active, really understand research and make decisions based on the evidence they see before them. I think one important thing to say about SACN is they have lots of checks and balances in place to ensure that their conclusions are not biased. That includes a framework by which they consider evidence. They don't take on published studies. They don't take very small, badly designed studies. Studies have to meet a certain quality control, and that will always limit their conclusions to what the evidence firmly says. Nutrition, that's really important because there's a history of drawing conclusions too early in a research process, which can be wrong. They can just be wrong, which you find out in the fullness of time.
So removing conflicts of interest from SACN and all other government advisory groups is going to be difficult, but not impossible. As Chris says, it'll take concerted effort, but it's one worth making.
I have a great deal of sympathy with scientists who take industry money to do their research. We do not adequately use public funds to fund particularly research in nutrition. Part of that is because industry is so willing to fund it, so there isn't a demand. That said, you cannot have the Scientific Advisory Committee on Nutrition having relationships with these companies that are causing the problem. So I'm sympathetic to people wanting to pursue their research, but lung researchers are in the same boat when it comes to tobacco money. There are lots of industries that would be absolutely delighted to fund all kinds of medical research, but we say no to lots of companies funding particular research, and we need to do the same with food. So what is to be done is that we need, I would suggest there needs to be a really well thought technical implementation for how to deconflict SACN. I don't think anyone serious is going, overnight, we need to get rid of everyone on the committee who's ever had a relationship with the food industry. We need to create a standard, and there is a standard in the declarations at the moment of what constitutes a conflict of interest. And we could make a timeline where we say, well, no one new will be appointed to the committee with a conflict. And we could say within, plucking a number out of the air, within 5 years, we would have the ambition of SACN being deconflicted. There is an argument that I've heard from several people on the committee and around the committee that it's impossible to find high quality people who don't have relationships with the food industry. Now, these are the arguments that have been used to exclude people of colour, minority groups, women from positions of power for a very long time. In my opinion, they have no merit whatsoever. A committee of enthusiastic, slightly more junior but very smart academics which wasn't conflicted, would very likely do a much better job than a committee of extremely senior professorial experts who have relationships with the food industry. So to me, the conflicts are holding this committee back, and we see it in their work. So I think those arguments don't have merit, but we should be saying to researchers who are postdocs at the moment, but who may have senior positions or chairs in a few years, if you remain unconflicted, then you get a shot at being on this very powerful committee. And I think that'd be a powerful incentive.
At the BMJ, we're doing further investigation into the influence of the food and drinks industry on health and health policy in the UK, supported by Impact on Urban Health. If you have a story or information on this topic, please contact us on investigations@bmj.com.
That's it for this episode. We'll be back in a fortnight where we'll be talking about citizens' juries and how they are changing healthcare policy. Make sure you're subscribed and I'll see you then. I'm Cameron Abbasi. Thanks for listening.